Hello, my wellbeing buddies. It's me, the mental health nurse, and today we're going to talk about anger. I used to get a lot of people coming to the surgery to talk to me about anger, and I hear it all the time. I'm angry, I can't control it. I'm angry, I don't know it's coming. And that's really worrying because ultimately it means that we've got poor emotional regulation and poor emotional intelligence. And the reality is, we all go through anger. It's something that we all experience, and it's a feeling like any other happiness, sad, anxiety. So, anger is one of those emotions. We just need to learn what it is and how to help regulate it. So let's start off by discussing what it is. We'll look at some of the causes, some of the risks, some of the signs, understand how we can assess it, some of the natural treatments, and then some other medication treatments. So let's just start off by saying, look, most people feel angry sometimes, but it's affecting your life. And then this is the problem. So when anger affects your life and it affects the people around you, that's when you need to stand up and go, okay, maybe I've got an anger problem. And it's something that I need to look into and something that I need to explore. It's all about coping with levels of stress. And again, that stress level can be coming from other mental health conditions such as anxiety, depression. So it might be useful to do a mood self-assessment. And if you go onto some websites, you will see different types of mood self-assessments there. Now, there are different types of anger. We could have anger from 0 to 100, which is associated with some neurological conditions such as ADHD because their brain hasn't got that cooling part in the engine. Or alternatively, it may be because of substance misuse or other things. But what I'm going to do is we'll just run through some of the physical symptoms in which you're going to feel. So physical symptoms here can result in faster heart beating, your muscles tensing up, clenching your fists and feeling that tightening, the tightening of your chest and feeling hot. So if you're one of these people who say, I don't know that I'm angry, you must be able to read the physical symptoms within your body. And it might be the fact that your brain isn't applying this natural cooling part of the brain to calm everything down, to give you time to think clearly. And if you're quick to impulse and fast in your response, then you have to learn to read these signs to give you an opportunity to calm down. Other things that you might be feeling around your mental symptoms there, you might be feeling tense or nervous, sorry. You might be finding it difficult to relax. You may find that you're becoming easily irritable. You could be feeling that people are humiliating you and, you're feeling defensive. And again, you may feel that you're resenting other people. Equally, you need to notice the change in your behavior. So can you feel that your volume is increasing? Are you getting louder and louder to where you're shouting? Do you find yourself ignoring people? Are you gaslighting or starting fights? Are you breaking things? Are you throwing things in anger, in temper? Or alternatively, do you end up self-harming, which are all poor emotional coping skills to managing this piece around anger? So anger can be a real problem. It can be frightening for the person with the anger, and it can be frightening for people around you. So what are the things that we can do to help you to manage that anger, to bring it all down, and to treat this on a more natural level? So first of all, try to recognize those signs and symptoms that we've just covered. Recognize when you're feeling tense. Recognize that increase in your heart rate. Recognize that shaking. And as you do that, you're going to want to do some de-escalation skills. And that could involve counting, breathing exercises for 10 seconds, giving your body an opportunity to think without that flight response. And if you find that you're flighty, then you need to probably think about, I need to remove myself from those situations. Equally, recognize if somebody's gaslighting you. So, do you feel that you're constantly being poked for that response? If you do, recognize that and think about strategies to manage that. Talk to people about what makes you angry. So again, by being open, it will help you. And that may be the fact that you need to talk to family, friends, a GP, or even support groups or charity organizations. Because it may be the fact that you're carrying the weight of the world on your shoulder and you're feeling stressed and you've got all of this anxiety, and it's those little things that just get you to that flight response. So again, recognizing that you're able to talk to offload some of this anger is really important. It's about exercise, regularly going for a walk or yoga or some kind of stress reduction activity to lower your adrenaline levels, lower that heart rate, and learn to keep it nice and calm. It may be things to do with your self-esteem. So you may want to do some work on raising your self-esteem, your personal awareness, and about the way that you feel about yourself. And that could be developing more assertiveness skills, or just feeling that you're in control of a situation and you don't need to go to that flight response. So that might be mantras, I've got this, I'm okay, I can handle this, everything's all right. Again, consider the support around you, and that might be online things such as websites. There's apps on your phone that you can download. There's breathing exercises that you can do, real good distraction pieces to keep you calm. On the NHS, in their websites, they've got mental wellbeing audio guides. So if you typed NHS anger audio guide, you can come up with some really nice guides just to help you manage and de-escalate. Equally, you could try some self-help CBT techniques, and that's from Every Mind Matters website. And in there, they look at how to manage unhelpful thoughts, because once we've got a thought, we can feel paranoid. That paranoia is driving us forward. We're ruminating and spiraling, and then all of a sudden, we've hit our flashpoint. So just learning those de-escalation skills, keeping ourselves well managed and contained. It might be the fact that we need to reframe a situation. And when we mean by reframing, it's where we look at a negative thing and we try to find the positives in it. So for example, yes, I may be short-tempered and flighty, but today I managed that really well. And I managed it well because. And so just reframing the way that you see things can help reduce the tension in which you're building up within your mind. It may be coping skills or problem solving skills that you need. So it's the littlest of things winding you up. And it might just be simple things that you can do to help manage yourself. So again, it could be the fact that you're getting angry because you've got no money, or you've got no food, or you're going to be homeless. Again, lots of charities and organizations out there to help you to manage these situations so you don't end up in that situation. And finally, another really good thing about anger is then managing your stress levels. So identifying the fact that we all have what's called our stress cup. And if our stress cup is full, it takes the tiniest of drop to tip us over. So if you are able to manage your own stress cup, recognize when you are at your limits, it's down to you to put yourself in a position where you can de-escalate and find that space to manage yourself well. Equally, there are other things that you can take, herbal remedies. So again, if you go to your doctors, there's things like Quiet Life. Again, look at your sleep hygiene. Is that, you're sleeping? If not, look at that. Are you eating well? If not, look at that. And look at all of those triggers around you. And then hopefully that will reduce your anger on a daily basis. Now, what we don't want you to do, so these are the things to absolutely avoid. Don't try to do everything at once, because the moment you try to do everything at once, you'll fail. And if you fail at something, you're going to get angry, and that's going to be your trigger. So set yourself small, achievable targets. Make sure they're smart, specific, measurable, realistic, relevant, and time-bound, something like that. Don't focus on the things that you can't change. I love this phrase because ultimately, why are you worrying about the stuff that you can't change? If you can't change it, accept it. And there is therapy out there called acceptance and commitment therapy, which basically means I'm going to accept the situation and I'm going to commit to change. I'm going to commit to something that I can or cannot, something that I can do to help manage that. Equally, try not to tell yourself that you're all alone. So it's that negative thinking. So the moment you get that negative thinking, start to replace it with positive mantras. I'm okay, I'm in control, I can manage this. And finally, if you are somebody that struggles with anger, avoid stimuli, avoid smoking, avoid alcohol, avoid gambling, avoid drugs, avoid triggers, and avoid the things that contribute to poor mental health. Because if you put yourself in those positions, undoubtedly you are going to end up angry. So if none of that works and you still think, well, look, Steve, I still need a bit more support, there are anger management programs out there. So typically an anger management program may involve one-to-one counseling, and you can do small groups with that. You may be able to do a day group, you may be able to do weekends and large programs. So depending on what's available in your area. Cognitive behavior therapy is obviously the way to go, because if you've got cognitive behavior therapy, that's thoughts, feelings, and behaviors. So what are my thoughts? Why are they turning into these feelings? And why are these feelings turning into this behavior? Equally, you may just find some counselling might be useful. So just look on the website for local charities and services to help you there. So what if that all still carries on? And what if I've still got a problem? When would I go to see my GP regarding this? Well, ultimately, if you're still worried, if you're still stressed, if your mood's going on for more than 2 weeks, then maybe there's something a bit more going on here. Maybe there is something around depression or anxiety. Equally, what do you do if you're in an angry episode and you can't come out of it and you feel you're at risk or you're going to put somebody else at risk? Then obviously you need to ring the emergency services. Ultimately, if you think you're in an angry situation that you're going to cause harm, again, call 999 or go to a place of safety. So what causes anger? Many different things for different people. And that's the weird thing about this. It's very personal centered. And the reality is we all have different levels of coping skills. So we can't measure people's response mechanisms to certain things. So for example, things that can make us feel angry is if we're feeling that we're being treated unfairly, if we feel powerless to do something, if we feel threatened or attacked, our natural response system is to go to that fight mode. It may be the fact that we're having a problem with authority, or we've got an issue there that we need to manage that, and that's going to trigger us into an angry state. It could be the fact that people are interrupting you, so you're not achieving your goals because you've given yourself these deadlines. It's all about how you react, and it's about that situation in that moment. And again, we can have a sliding scale on anger. Do we just say a few curse words do we become physically harmful to others? Equally, hereditary, is it a learnt behaviour? So if we've seen our parents be angry and fight, then we've seen unhelpful ways of dealing with our feelings, and therefore it forms part of our personality. So that may take a bit of work to manage that anger to come through it. Equally, it may be a flashback, a PTSD piece, so post-traumatic stress disorder. Is it something there that's triggered an emotional response and we've gone to our anger mode? Or ultimately, is there something around our substance and alcohol misuse and that's got us to our anger part? What's important here is if anger carries on, it can become uncontrolled. It can lead to domestic violence. It can lead to threatening behaviours in relationships, and therefore it's really important you seek help quickly and swiftly to manage your anger. Ultimately, from a medication point of view, when we go to the GP, there's very little in medication-wise that a GP can give you to help you. They may talk about a sedation just to keep you a little bit calmer. it's unlikely. And they may recommend an antidepressant to manage that anxiety, or something as a beta blocker just to manage that calmness. But ultimately, anger is an emotional response. And what is helpful here is you learning your triggers and managing to de escalate those situations. So let's summarize. So, what is anger? It is, for most people, a feeling that we become overwhelmed and we respond through a negative system. So we get angry, so we can shout, we can scream, we can punch, and we can become violent and aggressive. What causes anger? Lots of things. It's to do with your emotional intelligence, your coping skills, your emotional resilience, and the way that you are brought up. So if you've been role modeled great ways of managing feelings, you're probably going to be slightly better at this. But equally, it's stresses and triggers and poor sleep and not eating. They all trigger anger and substance. Risk factors. Well, again, it can lead to domestic violence if it goes on untreated. So we want to make sure we get this sorted. And equally, you can threaten people and it can be harmful to yourself. How is it assessed? Well, we can keep mood diaries, we can do a mood self-assessment, and we can keep an eye on that. And again, we can present that information to our GP if needed, if we're unable to manage this naturally. How is it managed naturally? So we did lots on that. We talked about cognitive behavior therapy. We looked at one-to-one anger management programs, and we've talked about good sleep hygiene and recognizing ways to manage ourselves and well-being. And ultimately, if you're then looking at something down at the bottom to manage this through the GP, they may look at maybe some kind of sedation drug, or alternatively, they may be looking around things like antidepressants to help lower anxiety and stress in the body, or even perhaps beta blockers. But again, that's entirely down to the GPs to decide what they want. Anyway, I hope you're nice and calm. I hope you found this session useful. My name's Steve, and I'm the mental health nurse. Thanks for watching.